body, and basically a nonsense signal from one cell can basically damage the entire network. It can disorganize a very large part of the system. And then in 1999, another Nobel Prize in Physiology and Medicine indicated there is about 1 billion proteins, not just collagen. Collagen is one out of the 1 billion proteins. So this is something you need to consider. And it's about 100 billion cells. And all of these proteins are carrying messages like addresses or zip codes that can guide different messages on where they should go. Now, main hormones, the hormonal decline is IGF-1, testosterone, estrogen, progesterone, and DHEA. Low thyroid hormones lead to inflammation, immune dysregulation, and a leaky gut. And the decline in metabolic hormones in aging causes a reduced resting metabolic rate. That means as you're sitting down, you burn less calories as you're aging. That's why you're putting more fat, whereas the young person, even with a sitting, they're burning more calories. Now, the inflammation is vital for the young, is very damaging for the old, so it leads to mild chronic inflammation that, of course, gets diabetes and heart disease, cancer, and other diseases. Toxicity, it's well known. Of course, it's everywhere. We walk outside and we can become toxic. And anger makes us toxic. Misuse of antibiotics, smoking, drinking, all of those things. Now, but the most important thing about toxicity is that it affects the hormones, leptin and adiponectin and hypothalamus. So the more toxic you are, the more hungry you are. And the more detoxed you are, the less hungry you are. So that is a very important point about toxicity and why detoxification is crucial. Now, the visceral fat, let's talk about visceral fat. The problem with visceral fat is not just that it wraps itself around the organs and kind of sort of suffocates them, but it also invades them because it carries the free fatty acids into the liver and the pancreas, and basically it compromises their function. Now, visceral fat cannot be reduced with radiofrequency, liposuction, plastic surgery, or lasers because it can be very damaging for the vital organs. And it cannot be removed by visceral exercise after a certain time. Of course, in younger age you can, but if you start exercising after 45, you're not going to get this. You're going to get this. Basically, what you see is you're going to get muscle, but it's going to be on top of your visceral fat. Why can't you exercise at older age? Because of body aches and because you have lower energy. You have a greater risk of injury, and people on statins, for example, that have a cardiac illness cannot exercise. People get different atrophies in the muscle and so on and so forth. Now, we have a lot of clinical studies conducted by a number of investigators. Started with Gerry Pollock. He was in London University, and he invented this, the first pacemaker, and also this technology that is like a pacemaker for the motor nerve, pretty much. And what he created is something that creates a contraction that lasts for about 8 seconds. Now, you see, only professional athletes can have a contraction that lasts like that. You cannot lift weights for that long, basically. Or have a sit-up that lasts that long. And you cannot do about 1,000 sit-ups, which is what this technology gets you to keep doing. And so basically your grandmother can work out just like that at the rate of a professional athlete. Now, this technology was utilized primarily with a lot of NFL players who bought it for themselves, but we can only mention the name of Roman Ober. Roman Ober had a very serious injury in 1995, and he was not supposed to ever play football again. It was only one person in the United States that could do this. He was working for the Chargers there, San Diego Chargers. And after we did this technology, he was able to recover, and he later on played for the New York Giants in 1999. Dr. Pollock did an earlier research on whether this technology is strenuous. It basically puts the body under distress, and looked at cortisol levels, and there was no significant difference. There was some difference, but they were probably just incidental. There were it's not significant results. So this technology does not lead to stress of the body. And there was a number of data collection in the USA and Canada from a number of different studies. And as you can see, there was a significant reduction of body fat and increase of muscle mass, but the water content remained the same. The reduction of the inch loss is not due to water loss. A diabetic, Dr. Badami in India did a lot of research on diabetic patients, and did sonogram reports on fatty liver before and after, and he found that there was no fatty liver after in sonography reports after the technology, and there was a reduction of the diabetic status, and also the back pain was improved. And weight loss, of course, was reduced. Another, again, study by Dr. Badami, actually it's the same study. She had about 25 patients altogether. And again, there was a lower back pain, and there was significant weight loss and significant improvement in diabetic status. This is another study that, clinical study that we did in Hong Kong, before and after of some patients. This is only one treatment. This is one treatment. Quite significant results. We did a study with MRIs. You can use Tanita scale, but it doesn't quite give you, sometimes it does, sometimes it doesn't. It's not very consistent. But the MRIs are far more proven to show the difference in the visceral fat, and there was a significant reduction of visceral fat before and after. Direct treatment, 19 subjects, none of them were diabetic. With diabetes, we do need a lot more treatments, up to 30 treatments. Also, it was a significant increase in muscle mass, the same study. Now, how does it work? Basically, it's signaling. A neuron, you can see a normal neuron, and you can see a damaged neuron or a diffused axonal injury. And what signaling does, it basically reconnects the signals. And how does it do it? The co-inventor of the pacemaker was looking for the motor nerve blueprint signal. And he spent 17 years, it was an atheoretical research, and he was just adding on waveforms one on top of the other to basically get onto your oscilloscope the signal of the normal neuron with his device in, an earlier kind of aspect of the device that later became the technology. And again, this 8-second contraction is very different than a muscle stimulator that basically is a bunch of bursts that stimulates individual muscle. This technology stimulates a group of muscles that work together simultaneously, the way it happens during exercise. And of course, muscle stimulators have been widely criticized because they deplete ATP production. This is how it works. Basically what it does, it gives a signal to the motor nerve, and the motor nerve, it will radiate that signal to the motor nerves around it. And as it radiates to the motor nerves around it, there's going to be waves of motor nerves that will eventually reach the brain, because all signals from the central nervous system that the motor nerve is part of reach the brain. When they reach the brain will start responding the way it responds during regular exercise, which is to release thyroid and growth hormones that will get the lipolysis started. the insulin will start getting into the adipocytes, which will start shrinking because they will release their contents into the bloodstream. The contents of the glucose will burn in the mitochondria to create energy, and with actin and myosin, which is some main proteins, will form the muscle building. Now, how it decides a multi-sign waveform, it's like a puzzle that you put different waveforms, like in a puzzle together, like a puzzle, you make an image. It's not like you can see there a digital signal that you cut off the waveforms, so it's not the same thing because that signal, the digital signal is harmonic, so it has to be an unlimited resolution signal, otherwise it will not be able to talk to the body. The digital signals, unfortunately, do not speak to the body. And basically, just like active exercise, it resonates and stimulates the motor nerve, and as a result, it goes, the motor nerve will go to the brain will start releasing hormones, and the hormones will burn fat as an energy source. Well, they don't burn the fat, they basically utilize the fat as an energy source to build the muscle. And Golding in 1991 in London University was working with Gerry Pollock. He looked at, he analyzed RNA, and he looked at the expression of genes, and he found that there was an expression of skeletal genes that were associated with overload, stretch, and physical exercise, implying a kinship between this exercise, effortless exercise technique with physical activity. And this is part of his, from his published research. Now, another research with 19 subjects looked at free T3 levels, and there was a concentration, there was an increase of T3 levels after 12 treatments, 19 subjects again, and significant increased DHA, which also involved in bone density and collagen, and a significant increase in triglyceride, a decrease in triglyceride levels. Now, there was a lot of research that I have done on blood. There's the red blood cell separation. However, what you need to remember is that as you separate red blood cells, the red blood cells also carry not just oxygen and nutrients, but they also carry the waste products to the kidneys, so it assists the lymphatic system for detoxification. And we also found a reduction of fungal forms, bacteria, and oxidative damage after 6 treatments of this technology. This is a clinical study on lymphatic drainage before and after on the knee of a diabetic patient. Now, how does it increase fitness? The American Heart Association researchers in the Cooper Institute in Dallas looked at 722 men, and they looked at the C-reactive protein levels, and they found that men that were higher in fitness, no matter how they got their fitness, whether it was a regular exercise or effortless exercise, people that were more fit overall basically had lower C-reactive protein levels. So basically, the inflammation was much less in those individuals. Fiona Mack from Hong Kong, she did some studies. She looked at the patients, and she reported that there was a reduced nausea and increased energy from leg swelling because of the lymphatic drainage, and also an increased energy and the reduced swelling. Again, the lymphatic drainage basically how it affects. Now, how does it increase energy? There was a Nobel Prize that showed that the 80% module, without electrons, it basically spins counterclockwise, so it basically breaks energy down. And when the electrons, which is what this technology does basically, blast the organs with a bunch of electrons, what the electrons push the protons to push the 80% module to move clockwise to build ATP. So basically that is the process as in which the energy is increased. Why does it not have muscle pains? It's because you don't expand energy, so you don't need the anaerobic mechanism of lactic acid. Lactic acid is another mechanism of energy producing mechanism. You just have as much oxygen as you need, so there is no lactic acid and therefore no muscle pains the next day. It has a number of different applications, of course, for diabetes, for gynecologists, for postnatal, cardiologists, orthopedic doctors, bariatric surgeons, fitness centers, and so on and so forth, lymphatic drainage centers, and a number of different applications. And this is, the certification is FDA cleared, ISO, and CE mark. Thank you very much for your kind attention.
Thank you very much for this great lecture. Just stay there for 1 minute maybe for answering questions. So as you saw the CE market, how the technology is available in the market, what the name is?
It is available, yes.
And the name of the technology is?
It has had several names.
Yeah.
There was also an early technology that was that got the CE mark 2 for incontinence,
Yeah.
specifically for incontinence. And different names. Now we call it the virtual gym, because basically it does just that. It's like a gym that can, but the very interesting part about this technology is because it kind of gets you to work out when you're not working out. It works on your visceral fat. So I'm an example of this. I have no visceral fat. I'm 65 years old, and I have no fatty liver, no visceral fat, nothing. And I mean, this is the important thing. It's a very interesting technology. I'm very thankful to Dr. Pollock who invented it.
So honestly, I need this, so at least. So, thank you very much. So I call for the next